The Vercise Genus Deep Brain Stimulation DBS system, developed by Boston Scientific, is a next-generation neuromodulation platform designed for the treatment of movement disorders, particularly Parkinson's disease (PD). It provides high-precision, programmable stimulation of neural targets such as the subthalamic nucleus (STN) and globus pallidus internus (GPi) via directional, constant current stimulation, minimizing side effects while maximizing motor control. The system combines current steering architecture, directional LED technology, adaptive programming, and MRI-conditional capability in a fully implantable, Bluetooth-enabled device. The Vercise Genus system is built around a constant current, implantable pulse generator (IPG) that can independently modulate current across either 8 or 16 contacts, depending on the specific model. This is achieved through multiplexed precision current sources, which ensure that each electrode receives the programmed current amplitude, regardless of tissue impedance. The system offers adjustable pulse parameters, including an amplitude range of 0.1 to 10.0, pulse widths between 20 and 450 microseconds, and frequencies from 2 to 250 Hz. The waveform is charge-balanced biphasic and cathodic leading. These parameters can be individually tailored for each contact, enabling the clinician to sculpt the electric field with sub-millimeter precision. Additionally, the system is compatible with Cartesia segmented directional leads, which are composed of 4 1.5 mm long contacts arranged in 3 120-degree segments per ring. This design allows for azimuthal steering of the electric field, facilitating asymmetric stimulation to direct current away from non-target regions such as the internal capsule. By redirecting current in this manner, the system can reduce stimulation-induced side effects, including dysarthria and paresthesia, thus improving therapeutic outcomes. The Vercise Genus IPG is offered in rechargeable RC and non-rechargeable PC variants. The rechargeable model uses a solid-state battery with inductive charging and an average lifespan exceeding 15 years under typical use, for example, 130 Hz, 60 microseconds. Power delivery is supported by precision DC-DC converters and low-leakage switches for efficiency and heat minimization. Wireless programming and monitoring are performed via Bluetooth Low-Energy Bell, using the clinician programmer tablet-based interface and patient remote, both equipped with encrypted telemetry AES 128. Data transfer is compliant with FDA cybersecurity guidance and supports remote firmware updates and parameter logging. The system is full-body 1.5T and 3T MRI-conditional, contingent on following specified scanning parameters. The IPG and leads are engineered with MRI-safe materials and feature tuned LED impedance to avoid RF-induced heating. Electromagnetic testing per ISO TS 10974 has validated safety under normal scanning protocols. For implantation, the system integrates with BrainLab elements for stereotactic trajectory planning, lead reconstruction, and post-op verification using fused MRI-CT datasets. This supports some millimetric accuracy in targeting and optimization of electrode orientation in directional leads. Programming of the Vercise Genus system is guided by stimulus response modeling, which is visualized through a graphical user interface GUI that incorporates 3D electric field modeling. The system features MICC, multiple independent current control, enabling the generation of overlapping fields from adjacent contacts to create smooth steering curves and precisely shape the volume of tissue activated, VTA. The clinician interface provides a range of tools to optimize programming, including threshold testing, automated symptom mapping, and the ability to test both monopolar and bipolar configurations. It also includes integrated boundaries for adverse effects to help avoid unwanted stimulation-related side effects. Furthermore, the system supports emerging adaptive deep brain stimulation (ADBs) protocols through external sensing systems and research use integration. These protocols can incorporate feedback based on beta band oscillations to inform stimulation adjustments. However, it is important to note that closed-loop operation using these adaptive features is not yet approved by the FDA for clinical use. The Intrepid trial, a pivotal, double-blinded, randomized controlled trial, demonstrated a mean increase of 3.03 hours day in on time without troublesome dyskinesia in the Vercise DBS group versus control. P 0.0001. Long-term follow-up confirms sustained improvement in unified Parkinson's disease. Rating scale UPDRS-3 scores and significant reductions in levodopa equivalent daily dose lead-D, improving patient safety and medication adherence. Data published in the Journal of Parkinson's Disease show maintained motor benefits and reduced adverse events over a 5-year period, with adverse event rates, infection, lead migration, hardware malfunction, less than 5%. Comparable or lower than prior generation DBS systems. The IPG casing is composed of hermetically sealed titanium grade 2, with laser-welded feed throws. Electrode materials include platinum iridium 9210 for corrosion resistance and charge transfer efficiency. Leads and extensions are insulated with Parlin C and polyurethane. RATED for IPX8 ingress protection and tested for stimulation cycles without dielectric breakdown. Lead design includes quadruple helix wire coils and strain relief segments to minimize micro-movement at the burr hole, reducing migration risk. All components are ISO 14700-823 and IEC 60600 1-to-1 compliant. The Vercise Genus DBS system exemplifies the integration of biomedical engineering, neuromodulation physics, and clinical software design into a comprehensive therapy platform for Parkinson's disease. With its MICC-enabled segmented stimulation, sub-millimeter targeting, Bluetooth programmability, and MRI safety, it delivers precise, durable symptom control while minimizing adverse effects. Clinically validated through randomized trials and supported by robust mechanical and electrical design. It stands at the forefront of next-generation DBS systems.